and welcome to Hack the Cycle. I'm your host, Nadia Okamoto, co-founder of August, the lifestyle period brand. We all might be aware of ultrasounds from movies or TV shows, but not everybody knows that sonograms can actually be helpful for a lot more things besides pregnancy, whether that be looking at a misplaced IUD or searching for uterine fibroids or ovarian cysts. Today, I'm going to meet with obstetric sonographer Natalie Sharon to find out just what an ultrasound can do.
Hello.
Hi, I'm Nadia.
I'm Natalie. Nice to meet you.
Nice to meet you. I have so many questions about ultrasounds.
How about getting your own ultrasound to figure out exactly what ultrasound is?
I'm super down for that.
Let's get started.
Awesome.
It's gonna be on top of your stomach, okay? You're just gonna feel a little bit of pressure. And you
Inside?
No, right on top of your pelvic. Are you ready to get your ultrasound?
Yes, I'm actually very excited. I was told that it's best to need to go to the bathroom.
Yes, so I do need your full bladder.
Yeah, I have a full bladder.
All right, so just unbuckle your pants, lower your jeans just a little bit. Yep, that's perfect. So I'm just gonna tuck this in your undies.
Okay.
Keep your legs straight.
Is the gel cold?
Today, I warmed the gel, so you're good. No cold gel here. I know, sometimes it's like in the
Really
movies,
cold.
it's always cold, and
Yeah.
like women are like so scared. The reason why we use gel is because without this, we're not able to see anything. So like this is your uterus. Fluid is black. See that black? That's your bladder. So if your bladder was not full, I wouldn't be able to see your uterus like I mentioned.
So that's my coffee.
Yeah.
How did you get into this field?
Being able to help women and like educate them. So I wanted to help women that had irregular periods, had painful periods, had bleeding after sex. So that's why I did it. And it's the best job ever.
Can you walk me through what a usual appointment would look like?
Well, you would come in with a full bladder, of course. I would look at your uterus, your endometrium, your ovaries, make sure everything looks good, send all your images out to a radiologist, and sign a report and send it off to your OB/GYN.
What are the big misconceptions that you hear?
Oh, well, as soon as I put the probe, they're like, I'm not pregnant, I swear. You're not here for that, you know? We're making sure your IUD's in place, you have an IUD, and then that's when I start to educate them.
What else can you see on an ultrasound?
We're able to determine if you have any ovarian cysts, fibroids, any endometrium polyps, also ovarian cancer. We check for your IUD. So we want to make sure your IUD is always in place, which should always be inside your endometrium. This bright line is your endometrium.
Wait, which part is the endometrium?
This bright line. Let's say your IUD would be misplaced. It would be any area inside the myometrium, which is the muscle of the uterus. That's what you do not want.
You can be completely honest with me. Looking at my ultrasound, is there anything you're like, ooh, you should get this checked out?
Your uterus looks completely normal to me, but your uterus looks good.
Can I have a photo of my uterus?
Sure, of course. I'll print that out just right now for you.
Ooh, a Polaroid could never. Thank you so much for this. I have a bunch more questions. So would you be down to sit down and have a little chat?
Absolutely, let's do it.
Thank you so much for my first ever sonogram.
Of course.
I think I've gotten ultrasound before because of a IUD. And how does it actually work?
The ultrasound, it's ultrasound waves. So as you saw with the probe I was using, that's pretty much entering waves into your body that bounces back into the machine, which creates your image.
And is there any risks with ultrasounds?
No risks at all.
What kind of symptoms would someone be having that would have their doctor recommend a sonogram?
Well, you can have irregular periods, heavy cramps.
For placing an IUD, is it required that doctors use some sort of ultrasound?
So it's not required, but I highly recommend due to the fact that we're able to visualize how far the IUD is getting in your uterus. So I highly recommend.
If the IUD isn't placed correctly, does it affect how effective it is, or is it just really uncomfortable?
Both. It can be really uncomfortable, it could bleed.
In an ideal world, you would like to see every time an IUD is placed for an ultrasound to also be performed to just check placement.
I recommend at least getting an ultrasound once a year. Always making sure it's in place.
Thank you so much for sitting down with me, answering all my questions, and for my ultrasound picture.
Uterus look beautiful.
Thank you.
Yeah.
Thank you.
Thank you. Thank you for coming.